We need to put programs in place in some of our other settings to ensure that we are targeting and doing some targeted interventions for this population.
Have you been able to detect HIV hotspots across Jamaica, communities which are of particular concern?
HIV is everywhere in Jamaica. There's no real hotspot. It's a sexual disease, and once you're having sex, you're at risk. However, we have recognized that over the years, our towns are the most likely places that are showing up our new positives. So Kingston, St. Andrew, St. Catherine as a parish in itself are two of our hot spots, or hot parishes, so to speak. In the tourism belt, we do have St. Anne and St. James. And so far, we're looking at Westmoreland and parishes within the southern region, especially Clarendon, that are now emerging as new places. Well, not as new places. There's an increase in the number of cases being found in those settings. So, as I said, we're a data-driven program, and when we see these increases, we respond accordingly in terms of channeling programs, resources to those areas so we can try and lessen the impact, so to speak, within those settings.
Is Portland also on your radar?
All parishes are on our radar. All parishes are on the radar, but Portland, not as much comparatively as the ones I had pointed out earlier.
But certainly St. Elizabeth.
St. Elizabeth, yes, to an extent, but not as much. The thing is this, and we have to recognize within the response how it is that we act. A rural response is totally different from an urban response. So the targeted interventions within St. Elizabeth would not match the targeted interventions within Kingston and St. Andrew, nor would it match that in Sav or in Westmoreland or in St. James. So our teams on the ground develop their plans, their activities to fit the population they are serving. So we know St. Elizabeth is a farming parish, and the team in the southern region has tailored some of their response to meet the farmers where they're at so that we can have a greater uptake, so to speak, in terms of our outreach services and our prevention services.
There has been an increase in prevalence among the homeless from 8.8% in 2010 to 2017, and you're seeking to find out what has accounted for this increase.
So I think it's two-pronged. I think we're doing much more work with the homeless in terms of screening. So NCDA, as well as our civil society organizations, they really have ramped up a lot of screening and systematic screening of our homeless population. That's one. So that has shown an increase in the population. Secondly, there has been an increase in the number of homeless persons as well. So there is also the movement of persons who would have normally been in homes to being homeless. So that could have also attributed to the increase.
Do you find that they're also at higher risk of abuse, especially amid the COVID pandemic?
I think that's a definite yes. It's a general problem, not just for PLHIV that are homeless, but homeless persons in general have experienced some amount of abuse on an ongoing basis. And it's something that I think we need to have a greater review of to see as a ministry, what are the next steps? NCDA does do a lot of work with the homeless, but again, it is not just about, it's not a health issue, it's a social issue. Homelessness does not fall under health. Homelessness falls under Ministry of Labor and Social Security. So asking a question along that line, and also our local government, we need to put programs in place in some of our other settings to ensure that we are targeting and doing some targeted interventions for this population. And the conversations are there. We have started the conversations, and there are activities going on in the other ministries, but there's always room for improvement wherever we find deficiencies.
People living in the country in Jamaica who are living with HIV, Are there other greater disadvantages in terms of access to support services, job opportunities, greater stigma?
For job opportunities, I think as a country, there is always a difficulty in the rural areas. So of course, our persons living with HIV will have less opportunities in that setting, as would other Jamaicans. In terms of access to services, and if you're speaking about prevention, treatment services, we do have both government and non-government entities, as well as private sector, private physicians who offer HIV care within our rural setting. And we have tried as a response, and I'm not just speaking as Ministry of Health and Wellness, we have tried as a response to ensure that not only do we expand our reach to our as many health centers within the rural setting as possible, but through JASL, there is the St. Anne chapter, there is the Mobay chapter that exists to offer both prevention and treatment services. And additionally, what we have seen with our persons living with HIV is that there is a somewhat of a migration, so to speak. So a person in St. Anne may not actually attend clinic in St. Anne. They may come to Kingston or go to Montego Bay so as to protect their status, so to speak. And there is some amount of social protection in place for them, for persons like that, in terms of offering them travel stipend so that we can offset some of the costs for those lengthy journeys.